Thank you, and welcome. Good morning or afternoon to everyone from whichever time zone you might be joining us. I'm excited to be moderating today's discussion. What's your New Year's resolutions to increase referral volume? It's crazy to think that we're already through and almost through 2015. So I'm sure everyone's kind of busy wrapping up projects, and we definitely look forward to giving you some pointers to be able to help kickstart your 2016 and kind of get the ball rolling on that. With that, let's just go ahead and have a quick look at today's agenda. I'll be doing some introductions. We have an excellent lineup of speakers with us today. Lots of great insights, so definitely look forward to taking notes. We'll have a couple of audience polls. We definitely like to keep these interactive, so feel free to chat any of your questions, thoughts, or concerns with us. We love to hear your feedback, and we really enjoy keeping these interactive. So look forward to a couple of those polls. We'll jump into our 4 resolutions and kind of the pillars that we'll be reviewing today. And pending time, we'll have some time for Q&A as well. So we'll keep those questions in mind as they come in. With that, let's look at our lineup of speakers that we have today. So we have Carrie Ann Craig, who is the System Manager of Sales over at Presence Health. Carrie Ann, thanks for being with us. Why don't you tell us a little bit about Presence and kind of your role there?
Thank you so much for having me. Presence Health is the second largest healthcare system in the state of Illinois. We have 11 hospitals. We have a full suite of post-acute services, which includes a long-term acute care hospital, 18 skilled nursing facilities, 15 independent and assisted living facilities, home care, palliative care, and hospice. In addition to that, we also have an employed medical group of roughly 350 physicians. And then we have a narrow network and health plan, which has roughly 4,000 physicians in it that are both employed as well as independent. We are an extremely matrixed organization, and I'll talk about some of that throughout today in some of the questions. And my role is to oversee operational support and structure of our sales force, which makes up 20 individuals throughout the state.
Excellent. So definitely a lot going on there, I'm sure. Well, thanks for being with us. And we also have Mitzi Kent joining us, Senior Director of Physician Relations and Industry with LifePoint Health. Mitzi, why don't you do the same and introduce yourself?
Hello, everyone, and thank you for joining. My name is Mitzi Kent. I am the national leader for our Physician Relations and Industry team with LifePoint Health. LifePoint Health makes up a total of 60-plus hospitals in 22 states. We're found in very rural markets where we are trying to, with our vision, trying to keep communities healthier. Our goal of our Physician Relations and Industry team is really to establish and achieve targeted sales goals and objectives for service lines with the individual facilities. My background is 20-plus years in healthcare. I am a nurse by background in oncology, pediatric oncology. Before joining LifePoint, I was with Gentiva Home Health and Hospice as their VP of Sales. So I do have a home health and hospice background as well. And then I, before that, worked 8 years at HCA where I started their physician liaison program before coming over here. I am a certified professional sales, selling skills trainer and conduct national sales training all over the country. Currently living here in Nashville, Tennessee, but a native of Philadelphia, Pennsylvania.
Excellent. Thanks, Mitzi. I know we've had a chance to hear your insights before, so definitely excited for today's discussion. And last but certainly not least, we have Amy Unger joining us, who is the Health Services Liaison with Atlantic General Hospital. Amy, why don't you tell us a little bit about Atlantic General as well as your role there?
Sure. To round out the spectrum, I'm actually part of a independent rural 62-bed hospital in Maryland, and I began the program about 3 years ago at our organization. So I am the one-woman sales force for my organization, and previously was fundraising for the same organization, but I come from a background in the for-profit world doing consumer research, strategic planning, that kind of thing. So it's been fun to apply those skills in the healthcare setting. So my role is vastly different, yet always the same as Carrie Ann and Mitzi's. So it should be a good discussion.
Yeah, it definitely sounds like we've got both sides of the spectrum. As I know that as I've talked to clients or people that have been interested with MarketWare before, it's great to hear those organizations that have been around for a long time that have kind of a fleet of sales teams and liaisons, and then it's very common we also run into people that are like Amy, kind of running everything at once. So great. Just to get a feel for where everyone kind of is in their maturity process, we'd love to just throw a poll out there that just is, what is the greatest challenge your organization faces with referral volume? And I'll kind of run through these different options, and feel free to chat in anything that's not listed here. But is it referral development? Are you struggling with just issues with overcoming some barriers there? Is it utilizing market insight or data? And then enhancing outreach management, is it particular things going on with your team and kind of your outreach teams, and we'll talk a little bit more about that as well. Or is it workflow efficiency, where maybe you have some of those goals and targets, but some of the processes aren't established, or you're still kind of in the infancy of your program and vetting those things out. Of course, you're welcome to let us know if there's a specific item here that's not listed. We'd love to be able to get some of that feedback and get an understanding of kind of where you are in the spectrum. So we'll give everybody kind of a chance to be able to answer that question. Amy, kind of any thoughts on what you've seen in the past with your current experience on where you think the greatest issue has lied for you or for team members as you talk to different organizations? Yeah, sorry. Just what you've seen out of the options here that you predict maybe most people are struggling with.
I think people are struggling with where to focus. I think that we're being asked to do everything all the time, and so what I've been trying to do is prioritize quality over quantity of outreach. So let's not waste time of the providers that we're calling on, and just make sure we're making good connections and really helping solve our organization's goals, as well as find out what they need to know more about, and then give them the help they need.
Excellent. So some focus issues there. Carrie Ann, what about you? Out of the options that you have listed, is there anything that trends that you've seen, or as you've talked to other organizations as well, that you think will kind of boil up to the top?
Yes, I would echo what both of the other individuals just said. We have, being a very matrix organization as we are, and the size of our organization, sometimes because we have people in the field who are face-to-face with these providers, everybody wants them to do something for them because they have the great relationship with the physician and they have the physician's attention. So it's prioritizing what is going to get us to our end goals as a region, as a hospital, as an organization. What do we really need to communicate to them to make sure it's worth everybody's time, and we're not just over communicating to our physicians. So it's really prioritizing their work is a huge thing, and making sure that they're efficient.
Excellent. Well, with that, we did get quite a few kind of responses here. I'll kind of go ahead and share with everybody where we're at with those different audience members. And you can see the breakup. One of the things that people said was utilizing market insight and data. I know we recently had a webinar about that as well, and was able to get a lot of insight. So I'm glad that that's one of the things there, because we will talk about each one of these different categories. Moving into enhancing outreach management, and then just referral development and being able to advance that. I think workflow efficiency is one that both you, Carrie Ann, and Amy touched on. Is I think a lot of that prioritization kind of rolls up under that workflow efficiency, and making sure you're asking the right questions and then being able to really streamline that process. So that's just a really good indicator as we move into today's conversation of points to kind of really drive home on. Great. So as I mentioned earlier, we are winding down the year and it's coming quickly. I don't know about you guys, but there are definitely days that I wish I had a bit of a pause button. As excited as I am for the holidays and looking forward to next year, there's still a lot of outstanding projects going on through the end of 2015, and I'm sure that a lot of you can really relate to that. So as we kind of look at this time of year, it's a great time to be able to reflect and say, what are the things that I wish that I know now at the end of the year that I wish wish I knew at the beginning of the year, and how would that have affected my strategic plans and overall kind of goals and objectives. So we'll definitely jump into that. I'm sure we are all familiar with setting New Year's resolutions, whether it's to eat a little healthier, exercise a little more, or spend time with folks that we really enjoy. A lot of times as we do set those New Year's resolutions, statistically those that don't get written down or really planned or vetted out, it's very often that we end up breaking a lot of those commitments. And so one of today's objectives is to be able to share with you guys some insights and then be able to leave the conversation and say, okay, these are some things that I actually really want to work on, and then to be able to put a stake in the ground on those, and then hopefully as you reflect at this time of year next year, you can say, we definitely were able to move the needle on some of those things, including referral development. So a quote that I really found interesting was one here by Timothy Crowley talking about going into a hospital boardroom, and 99% of the time they're talking about referrals or physician relations. And it's just been fascinating to watch the industry and how it's become a lot more competitive, and how physician relations and the importance of those referrals has become a hot button for a lot of executives. And everybody here on the panel I know will be able to share and talk a little bit about how that's affected their teams and things that they're doing to really see kind of success in that area. So the first kind of pillar that we want to jump into is talking about advancing referral development. As I mentioned, just from statistically, the last decade we saw about a 92% increase in referrals, and that rate continues to climb. Capturing market share through referral development is becoming more and more critical. And with referral sources being the key to the long-term financial success of every healthcare organization, we continue to see health systems acquiring private physician practices for this sole purpose. So I want to tee up the conversation with you, Mitzi, because I know you spent a great deal of your career in physician relations and referral development. Can you tell us a little bit about your approach in building up your program to where it is now?
Yeah, thank you, Crystal. There has been a lot of different strategies about building a team. So in my past career, I've had small teams and large teams. So I've had teams of just 5 all the way to currently what we have now is a team of 64 physician relations and industry representatives. But I do think when you're talking about building your program, the key really is to make sure that you get the involvement of key stakeholders within your organization. So anytime that I come into an organization or I'm working with an organization, I will meet with senior leadership to find out what are they wanting and hoping to accomplish with this program. What do they see valuable with the program? And what would be a measurable result that would indicate that the program is effective. And from that, then I try to measure or manage expectations and build the program through that. So for example, here at LifePoint, it was very important to take this program from not just a program where we had liaisons dropping by and just checking and seeing how everyone was doing, but using a very strategic, data-driven approach about how to impact their market and to align with the hospital strategic plans. So as I receive that feedback, and then that's how I start to build the program of what are the type of people that you need involved in that program, what are the skill set that you need to have, and then from there, what are the key things that we need to report out so that they can see that we're moving towards that measurable result.
Excellent. That makes sense, definitely. And Carrie Ann, I know you've got a great example as well. When you first started with your team, there wasn't a lot of that formalized structure. What steps were you able to take to streamline and formalize that? As I know that physician relations, the way it exists today, is still a little bit in its infancy, and there's still a lot of folks out there kind of trying to figure out the right balance on that.
Yeah, so my role, I've only been in it for a year here at Presence Health. We had, sales, so to speak, and liaisons throughout the organization. But since we're a merger of 2 larger organizations, they were a little convoluted, and who was doing what and what their strategies were and what their importance was and how their role really aligned to the rest of the system's objectives. So we started at the very basics, from aligning their job descriptions and their compensation and their incentivization and their reporting structure, because it was all over the place. And we had to really build a department from the ground up. And when we were in an era of eliminating a lot of positions, we were actually duplicating positions in our role and creating more sales force and more outreach individuals. So we had to really put a lot of priority around justifying the importance of adding all of these FTEs. So we aligned all of their goals with the strategic priorities of our system that were laid out by our system VP of Strategy. And then we would put all of their expectations towards growth, the number of physicians they should be targeting, the value to those conversations, and making sure they were all balanced in their target list. We had some folks who previously focused on 200 doctors and some who focused on 30. So we had to align them that way. We had to align their activity and their productivity standards and make sure that everyone was the same. And then each region was able to identify metrics that were important to that region that rolled up, so to speak, to all these other goals that we would then measure them on. So it's been a building year for us, and we're taking a completely different shift for 2016.
Excellent. And Amy, I know you can probably relate to a lot of these same processes and measure. However, for you, being a field team of one, how do you get resourceful and strategic in that way?
Sorry, working on mute. So my organization has my role in the same department as marketing. So what I would work to do is create quarterly goals, obviously matched up to the organizational goals, but I would try to time my activity with marketing as best I can, one, because marketing was creating my collateral anyway, but two, that way the physicians in the community, their patients might be asking them questions, so we want to make sure that we sync up those activities best we can. And I'm all about data. So just because I'm a small organization doesn't mean that I shouldn't be guided by the same strategic choices as a bigger organization. So using a lot of data sources, be it external claims data or just internal data as well, to target the right providers with the right message.
Excellent. That makes sense. And one of the questions that we had come in through the audience was really good, and it was around which management tools are you finding most helpful in your quest to increase your referrals? And Mitzi, I'll kind of kick it off with you first.
Thank you, Crystal. Some of the tools that we find are very helpful or within the MarketWare system, where the dashboards were created to help guide us to see where has the focus been with our representatives in the field. So many of those dashboards, we have a LifePoint activity dashboard created within LifePoint, within MarketWare that was very helpful for us and for our group leadership to show what was just measuring of activity of calls, but most importantly, what were the topics discussed? So again, aligning with our strategic plan, if the topics are, if the hospital strategic plan is to grow cardiology and imaging, but we find that the physician relations director in the field is spending more time talking about pediatrics, and we note that on that dashboard that they're having too many of those types of conversations, then we can help direct and find out, is it a comfort level? What do we need to do from a training perspective to help? So that topics discussed piece of that dashboard has been very helpful for us. The other key piece of it is just from an issue resolution. Many of our physician relations directors are very involved in the issue resolution process, and sometimes spend a majority of their time kind of holding on to that issue and feeling as if they need to be corrected or need to correct the issue instead of working in collaboration with the directors of the hospital. So that dashboard also tells us kind of how are they spending their time and what do we need to focus on.
Great. And Carrie Ann, I have the same question for you. As you have kind of built out that program, I'm sure there's still a lot of A/B testing on systems, but what's a management tool that you found that's been helpful for you?
Well, definitely our PRM solution as well as our internal and external claims data. And we've been really fortunate that about 6 months into rolling out all of these new roles, so to speak, our administration was really on board, and they really found value in what they were doing and the conversations that they were having. So as we would look at our claims data or any of the topics they would be discussing, or as Missy pointed out, issues that they would be bringing up, they would be right there with us having those conversations with physicians, or they would be right there with us having conversations with our director of our OR suite if there was operational issues, and they would be on board with looking for capital to help solve some of those issues because it's what the providers needed. So just through that collaboration that we've been able to pull from our PRM data and our external claims data, we've been able to have valued conversations and go, here's the proof. Now we need to do something about it because what they're telling us is true, and we're seeing their referrals go elsewhere because of it.
Well, that's great. And Amy, I guess for you, I'll kind of change the conversation up a little bit. But what has been a key finding for you as you reflect back on the year about capturing your referrals that you've been able to really learn and take away?
Well, this one's a bit different. So data, is extremely useful for guiding strategic choices. But at the end of the day, what we do is we interact with people, and depending on the office. To be fair, sometimes the front office staff is your key for referrals. And sometimes it's the really little things that can make all the difference. So a personal example, so I have a hard copy of a current medical staff directory. That sounds like nothing important, but honestly it's received like a gift at Christmas by some of these offices. And my management didn't understand initially. Their perspective is everything's available online. But if you put yourself in the shoes of a front office staff person, they're busy handling patient registration, checkout, co-pays, phone calls, and everything else. So if we can make their lives easier by giving them a hard copy of something, that might actually incentivize referrals. And you can ultimately track that in the data to see that actually happening. So don't forget we're in the people business, and that one-on-one conversation is what is going to move mountains.
Great. That's a good point to bring up, and really helps kind of set us up for talking about our next pillar around utilizing data-driven market insight. So a great quote that I once saw was that you can have data without information, but you can't have information without data. I think both Mitzi, Amy, and Carrie Ann have all mentioned data and kind of market insight as something that they've really been able to leverage as a strategic plan. And so Mitzi, I know that you and your team are very data centric, and you've had the ability to set up some of those dashboards. How has that played into your growth strategy, and what types of data and reporting are you looking at on a regular basis to kind of get a thermometer check on how your team is doing from a success standpoint?
Thanks, Crystal. Yes. So one of the things that we started doing with the data, and we took it in very small bite sizes, but we do utilize all claims data and Medicare claims data to help narrow where the physician relations directors need to spend their time. And with that, this year we incorporated it in their 2016 plan. So all of our hospitals do what's called a marketing and sales tactical plan. It aligns with the hospital strategic plan, but it specifically asks, and we do it in partnership with our marketing team, but what it does is it partners that marketing and salesperson to say together, what is it that we're going to do tactically to impact this strategic plan that the hospital has put together? And we have a format for it. They all input their tactics in there per service line, but we use data such as the all claims data and specifically the data that helps us from a market share perspective of where are we going to spend the majority of our time and who specifically are we going to target. We have found in success stories that we had that those that are able to use their time wisely and able to just pull that data and see where they need to focus and how they need to shift that referral volume or that market share, they've had a lot more success in the field and success with their leadership teams, and proving what a value-added position the physician relations director is.
Excellent. And Amy, how have you been able to transform your position? I think when I think of data, I always think of kind of the business analyst role, and I think of having a team or an operations team that you can go to and say, oh, where should we be spending our time? Where should we be focusing? But I'm sure that that's not always the case for everybody. So how do you balance your time and make yourself data resource savvy when you don't have the luxury of maybe having a team of analysts?
Yeah, so I get to wear two hats, which is fun for me because it's never a boring day. But directly, I would use data analysis to help me work on my quarterly goals, and that way I could strategically inform my outreach. But the rest of my time, I should be out actually talking to people. So a separate way that I've actually kind of borrowed an analyst was I positioned my purchasing of a PRM as a process improvement project for one of my financial analysts there at the hospital. She was spending about 4 hours a month manually pulling internal data to create a physician referral report that the organization was accustomed to seeing. So using the PRM, that data pulled and updated automatically, and got some pretty dashboards to represent the data graphically as well. So it not only got a little love from finance for me for making this purchase, but also got the data in front of senior leadership monthly, which I think helped make the work that I do seem a little more valid. So it kind of killed two birds with one stone for that.
Yeah, we talk a lot about ROI and making sure that everyone's able to kind of justify their roles. So that's definitely a good way to get some extra buy-ins. We've talked a lot about claims data, and one of the questions, I was talking to Providence Health not too long ago, is the types of questions that you should be able to answer. How are you able to answer questions such as who are your key competitors and how is that changing over time? And then who are the top performing providers and where are they drawing their referrals from? I know a lot of people here online, we've talked about focus and making sure that you're spending your time with the right people. Carrie Ann, what are some processes that you guys have been able to put in place to know answers to these types of questions?
So we have a referral management center for our employed physicians. So referrals that come into them as well as referrals that they send out. So we're able to kind of monitor what our employed group is doing and where they're getting their referrals from. For our network, the physicians in our health plan, we also have an electronic referral tool that they're able to use that we call Refer Connect. And so they can make referrals to whomever they want to, as long as that physician then is part of this electronic tool. So we've rolled it out to the 4,000 physicians in our network, and we're able to see if they are wanting to make referrals outside of our network or if they're making more referrals that are within our network, because some of them have also then tried to include other physicians into this tool as well. And it pushes out all sorts of reporting for us so that we can see what PCPs are aligned with what cardiologists, so to speak. And in addition to that, we do use the third-party claims data that will show us physician networks based on the common DRGs between their patients. And then our sales team works with our analytical team on a yearly basis to do some small form of a competitive analysis so that we can see what they're doing, particularly from a narrow network perspective, because it's something that's really starting to grow in the Chicagoland area.
Oh, some great pointers there, some kind of different out-of-the-box thinking for sure. And then Amy, how were you able to utilize data-driven market insight to increase incoming referrals? Because at the end of the day, that really is the goal. And one of the, when you look at KPIs, I know that is one that definitely comes up as a metric for success.
So I would probably reference a really recent example for us using data to help inform. In this case, we're adding a new service line. So I mentioned we're a small rural hospital. We've added pain management. So our organization didn't have experience with pain management before. So I used data to help me figure out, what types of providers were most likely to have patients overlapping with the service line. And then I was able to make the best use of my new provider's first couple weeks before his patient load exploded. As you can imagine, that's a pretty popular specialty, to ensure a couple of things. So one, that he was getting the right patients out of the gate. So this was an education opportunity for those prospective referring providers about, who really can he help, and then also to set expectations of what services this provider will and won't do. That way we have a smooth referral process and we're avoiding dissatisfaction by both referred patients and their referring providers.
Excellent. And we did have a question that came in from the audience. I'm gonna pass this to Mitzi. We had one that was very specific about how do you use data sources and which ones to determine outreach clinic viability. Is this something that you guys have had to confront there at LifePoint?
Absolutely. Thank you, Crystal. We have a strategy called our retail strategy, which is very focused on where is the best place to either focus on the business and industries or where to maybe put in urgent care, somehow a medical home for these patients that are not your traditional Medicare patients. So many of our markets is traditional Medicare, but what we're finding is that those that are seeking medical care and having a difficult time to find it that suits their needs are that commercial-based patient that is still the working force there. So there are many types of data that we use. First and foremost, state data is something that we use to look at how are we doing compared to our competitors when it comes out from an outreach opportunity. The market share data helps us to look for that out-migration, look at what we are losing out there to our competitors, and also allows us to establish that contribution margin. So is it worth for us by that patient population out there to be able to focus on that area, maybe put up bricks and mortar for an urgent care, or to look at some other retail strategy opportunities of PCP extended hours. We look at maybe opportunities to put what we call maybe an on-site clinic, nurse practitioner on-site clinic at our business and industry, or even a near-site clinic that will just help kind of impact that with the business. And then lastly, an overlay that we use is what's called tapestry data. And what that is if you think about when you're out there surfing the web and it just takes key points from the consumer, and what it's looking at is to determine your population. So how do we reach that population? So for many of our areas, we call it the cozy country living that pulls up. These are the people that are listening to country music and listen to CMT. They maybe are not reading, they're not on the internet looking for their news, but they still utilize the newspaper. Then that helps narrow our focus about how we're going to target that consumer. So again, marketing working in conjunction with sales for the boots on the ground. How are we targeting that patient from a marketing perspective and from a sales perspective?
That's very interesting, and I love some of the nomenclature you used there as well. It was great. Moving into talking about outreach teams, as we've all kind of mentioned, different aspects of outreach teams, whether you've got a small team or you've got a handful of different sales teams. One of the quotes that I heard is, a great physician liaison will be able to call physicians and say, we aren't seeing the numbers like we saw last year. Is there any reason why? And then what can we do to help you? The role of the physician liaison over the years has really changed, and I know Carrie Ann mentioned that it's very important when they're looking at the hiring process that they're hiring the right people with the right skill set. And it's not just about dropping items by, but it's more strategy, consultative focus. And so the question that I just wanted to ask is, as you look at your outreach teams, what is the greatest challenge that you're facing? Is it delivering value? Is it getting past gatekeepers? Is it maybe some unclear goals and expectations? And again, that kind of comes to the maturity stage you are at in that process. Is it not enough headcount that maybe you do see the value, but your team is having bandwidth issues because they're covering such large geographies or such high numbers of physicians and visits that they need to hit? Or is it something else? Feel free to chat us in there. Carrie Ann, any predictions on kind of where you see the genetic makeup of people struggling with?
I definitely think it's just a matter of, at least in our organization, what's important. We've been able to hire some really good folks that have that skill set of not being the information dropper offer. And they can really get to that strategic level. But we have so many things to focus on. And like I had mentioned earlier, because they're faced with that physician, with the relationship, so many people call on them for assistance, that it's really just prioritizing what's important, what's going to help them meet their goals that ultimately help us meet our goals.
Great. No, that definitely makes sense. And we'll give folks here just a few more seconds here to be able to kind of answer one of those. Amy, I'll kind of ask you the same. What's something that you feel that you guys have been able to overcome as kind of the choices listed here?
Well, I totally echo that sentiment about picking what to focus on. If I'm a sales force of one, it's all important. But also I think delivering value might be a big one too, because the work we do is so different than other people at the hospital. It's not as tangible maybe as a clinical outcome, or it's not as cut and dry sometimes. So it's really, the onus is on us to prove what we do and why it's important.
Excellent. And with that, we'll go ahead and just kind of close the poll and see kind of where we ended up. I think that we did get a good spread here just as I was seeing some of those results come in. So talking about getting past gatekeepers, I know Amy mentioned earlier the importance of kind of office staff and working with them. Not enough headcount. Again, some of that could maybe be workflow efficiency as well. I'm sure there's a lot there. And then we did get a good question come in. Kind of a side note to this was, how do you compete with other services that are free versus submission to insurance? Either Mitzi, Carrie Ann, or Amy, kind of any thoughts on that?
This is Carrie Ann. I can chime in here a little. We have a very large Medicaid population in one of our urban hospitals, and through that we do a lot of partnerships on free mammogram screenings through various foundations and a lot of Sabisa work, and that's all fantastic. It all really aligns with our mission. But then sometimes we'll have some of those directors of imaging, as an example, saying, well, you guys are pushing this free service, not my service, where I'm going to bill somebody's insurance. And so I think it's just refocusing everyone that has that relationship or that has that conflict, for lack of a better term, that we still as a Catholic healthcare organization have a mission, and by going out into our communities and sometimes offering these free services and making individuals aware of the type of healthcare they should be seeking, in the long run we'll start to see volumes come to some of our other entities or places where we are billing insurance, because maybe the daughter brings their mom for the free service and then says, I should probably get a mammogram too. And then she schedules an appointment, those types of things. So we really sometimes struggle with that because we are a very mission-driven organization. But at the same time, we put our mission first and foremost, and then hope that all of the other things come with it.
Okay, great. Now that's some good feedback there for sure. moving into our enhancing outreach management, how much time is spent in the field and what is being tracked. I know you guys have all mentioned some different aspects there. So while getting out in the field is important, who liaisons are visiting and what they are telling physicians will make or break physician relations programs. Equally, items such as collaboration, communication, and accountability are all important. One of the things that's been fascinating for me to listen and kind of observe is the different titles in kind of the hierarchy and the genetic makeup of different teams. And so I just wanted to get an idea and have everyone kind of share. I'll start with you, Mitzi, and then move into Carrie Ann. What are the titles that you've given your outreach team or coordinators, and then who do they report up through? Because from what I understand, I know, Mitzi, you guys have a very specific title that you like to use, and you've seen success with that.
Yeah, thank you, Crystal. So when I was brought on board, the title was Physician Resource Initiative, and I wasn't sure exactly what that meant. And as I spent time out in the field, I realized that those that held that title didn't know what it meant. So it caused great confusion about what it was. So I was challenged with changing the name of the organization, with changing the name of the role within the organization, and it's not a challenge that I hadn't faced before. I faced the same thing when I got to HCA, but they were very involved with that acronym, and that acronym was just something that definitely held very closely within the organization. I thought that I would spend more time trying to say, no, it's not that anymore than it's this. So went to the constituents, actually, went to our group leadership, our executive leadership, the Physician Advisory Council, and our own council within our organization to say, here are some thoughts of titles. What are your thoughts? What does this mean to you? What do you think they're trying to accomplish? So we switched the title from Physician Resource Initiative, and it's still PRI, but what it stands for is Physician Relations and Industry. And it is a director position, a director or manager position. We think that's very important so that you can align with your directors and your internal customers, so your directors within the hospitals, that when you do bring an issue back, that you're on a very collaborative setting with them by making it a director. But we had to expand who we were calling on. We realized in the rural markets it just wasn't physicians anymore. We realized there were other places that were giving us referrals that no one was giving attention to. And part of that was the business and industry. And so to put that into the title of Physician PRI, Physician Relations and Industry Directors, we felt that it would be a constant reminder that to realize we are not just about physicians. We are about anybody that can be a referral source. Now, I do have some hospitals where they have a greater makeup of nurse practitioners than they do of physicians. And in some of those cases, we just changed physician to provider, so provider relations and industry. So in some of our markets, we do make that change just so that the nurse practitioner feels very involved and that this is their key person. The position reports directly to the CEOs of the hospitals. Predominantly, that's the way we like it and want it to have it structured. And then they have a dotted line to myself and my regional director here at the Hospital Support Center to help guide and coach them through the organization.
Great. And Carrie Ann, what have you guys seen from success on your end in terms of titles and coordination as well?
Thank you. Well, as I had mentioned earlier, we had to go through an entire reorganization from job descriptions to job coding, et cetera. And we are set up very similar to how Mitzi described, where we call our folks provider engagement executives. We use the term provider also because we do call on mid-level providers, nurse practitioners, physician's assistants. Case management is extremely important to our post-acute services, and we put the executive title into it because they are a direct reflection of our executive team at each one of our hospitals. And so when they go and speak with our directors at various levels and managers in various departments, they get the buy-in that it's not just a sales rep, quote unquote, telling them what to do or what they need to potentially improve upon. They also then report directly into their regions. We have a structure with a regional director of business development and a chief strategy officer within the CEO and executive leadership team of each region, and then they dotted line to myself at our system office, in similar to Mitzi's role, to help push them through our system and align them with all of our system initiatives and those types of things.
That's good. So like I said, just kind of a different approach there. And then Amy, I believe you guys did refer to your team or kind of yourself as a physician liaison, kind of health services leader that way, right?
Yeah, so we created the role and we called it health services liaison. It's funny, so we're in a rural area as well. And because I've been doing fundraising, we thought the link to business would be helpful because you're right, you can get referrals from anywhere. So we were trying to make it broad. At the end of the day, I'm the tall blonde girl who calls in your office, and that's what they really know. So you can work on titles all you want, but it's the face that they recognize at the end of the day that actually matters.
That's great. And looking into metrics and kind of moving the needle on things, Mitzi, what's a metric and a process that you guys have put in place to justify improve the liaison ROI, as that is a hot topic of conversation? I remember I was talking to one of the children's hospitals, and they mentioned they have one liaison, and how do they ensure and justify to executives we need another team member? What are you showing on your end to stakeholders to be able to justify those metrics?
Thanks, Crystal. So yes, we are utilizing the data to determine our ROI. So from a business and industry perspective, we are measuring the commercial volume coming in from that particular industry before that they get enrolled with our hospital to partner with our hospital within a business and industry. So strictly looking at volume and volume increase and the impact of how many calls that this person and activity that they're doing with this particular account, and tying that to a true ROI volume increase, because at the end of the day, that's what we're trying to do, is grow volume. So many of our data that we get is a push out of our cost accounting system, where we are able to look at physician referral data. So I can see trended how much he has given me from an MRI volume, CT volume, and from that we use kind of that activity. We called on these doctors, we discussed these type of topics, and in turn his volume from MRI went from 6 to 15, and we can kind of justify that through that time period. So those have been some key things that we've been doing from an ROI perspective. I hope that we get to a point where we are building some of those dashboards within Marketware to do that and utilize that, and I've seen it within Marketware and like that. But for us, legally, we've got to work with our legal team about do they want that kind of correlation or that relationship, kind of a dashboard within our CRM tool, and then how do we utilize that? How do we dispatch that to the field and to others that are looking at it?
Excellent. And Carrie Ann, similarly for you guys, as you have learned and as you look back and reflect to the beginning of the year, what are some things that you've been able to see from an ROI standpoint to say, that the new processes we put in place are working and we are making traction on those?
We again would echo a lot of the things that Mitzi just pointed out. We each have, within each region, we have budgeted goals for whether it's particular physician growth or surgical volume growth or service line growth, and we will aggregate our own internal information from our financials and from our own data sets, and we will just kind of do a cross-section analysis based on the targeted list of physicians that each liaison may have, as well as what was their activity with those physicians. Are we seeing trending changes in, as the example Mitzi used, MRIs because of conversations we've been having with that provider? So it takes a little bit of legwork because we're in the same way with the dashboards. I was literally nodding my head the whole time she was talking, going, yep, yep, yep. So that's really how we're able to justify just in this short time. We have seen a major increase in some of our volume just by getting back out there and talking to these providers again and educating them, being a system that merged from two larger systems, and just educating them on, yes, we still have some of these services, yes, the quality is the same, yes, we're still here to be your preferred provider of choice, and we've been able to see the needle move.
That's great. That's great news. That's, like I said, at the end of the day, that is very important when it comes to getting that stakeholder buy-in, is being able to speak kind of to that data and those results. When it comes to testing out different methods, Amy, I was just curious on your end, what are some ways that you've been able to test different methods of physician engagement opportunities, and how often are you going back to that process and kind of reiterating things?
I would say that I think about each campaign I do as a unique one and try to tailor the outreach accordingly. Constantly reapplying and evolving best practices, but when opportunity strikes, try something different, I do jump on a chance to think beyond our traditional thoughts on who the target audience should be. So little example. So we were going to do an educational dinner, and I invited the nurse practitioners from our walk-in clinics on a hunch that, one, they probably don't get invited to much because often it's the internal medicine or family doctors who get invited to dinners. And that there are patients who kind of fall into that gap. They don't go to a primary care, but they use these walk-in clinics staffed by nurse practitioners primarily for their healthcare needs. And I will say it was so warmly received. Every single one of them showed up. They asked great questions. So, as you think about how you're engaging with your providers, just it's not a totally systemized process. Each campaign you're doing, the tides may have changed. So just be open-minded to bringing in new folks or doing it in a slightly different way.
Great, and that just really leads us into kind of our last discussion. As a couple of you guys have mentioned, talking about technology, and one of the pillars that we had was workflow efficiency. And how can we better set that as a resolution to really streamline that workflow efficiency and making sure that we're not duplicating processes, whether it's service line development plans, and how are we really trying to kind of templatize things and, again, just be more efficient with the resources and the staff that we do have. Just one of the great quotes that I found was talking about technology and automation is great and can be helpful, but only to the extent that the process itself is already efficient. And as I've kind of heard, different aspects, I feel like this really resonates well with where a lot of you are in your organizations today and kind of the maturity model. So I want to kick things off with you, Carrie-Ann, is how do you foster an environment of communication and collaboration working with the different teams? Because that seems to be one of the key ingredients of having success with your team and probably your organization as a whole.
Well, so when we rolled out our PRM, we rolled it out to anyone who was in a strategic or growth-related role within our organization. So it's not just our provider engagement executives who are on the tool. We have community outreach individuals who do a lot of work with other stakeholders at various religious organizations or aldermen and other government dignitaries. We also have our regional directors of marketing who are active on this tool. We have our regional directors of business development on it and our growth officers on it, as well as the folks who work within our network development for our narrow network, because we're all out engaging these providers, but with very different messages and in very different ways. So we have made sure that we are all talking the same language and documenting it in the same area so that we can make sure to foster that relationship with the provider. We're not taking up too much of their time by having one person from Presence Health and Network Development knocking on their door on Monday, and then the provider engagement executive knocking on their door on Tuesday, and then the community outreach person knocking on their door on Wednesday to see if they're interested in a speaking event. So we use this tool as a way to communicate as well as collaborate. And in addition to that, we meet monthly by region that pulls together that entire team: marketing, communications, PR, community outreach, provider engagement, business development, and we really talk about what we've got going on in the field, what's coming down from the system perspective, what's coming up from the region, and what we're all working on and where are our areas to collaborate and work smarter.
That's great, and that definitely makes sense. As we kind of wrap up here, I'll go ahead and ask Mitzi you the same question. What's worked well for you guys in terms of not causing duplication? I think Carrie Ann brought a great point of making sure that you're not having 3 people hit up the same person within a 24, 48-hour window. What are some processes that you guys have done to ensure streamlining your workflow efficiency?
So a lot of that's done through collaboration of call calendars so that they're sharing that. And most importantly, we have in our facilities what's called growth teams, which is a monthly meeting or a biweekly meeting where we sit down and we discuss what are the ways that we can grow as an organization, as a hospital, and it's got key leaders around the table. And at that point in time, they're sharing about kind of what is the expectation of the PRI out there in the field, who are they going to be calling on, what are the topics that are going to be discussed so that there is not an overlap.
That definitely makes sense. And Amy, I'll kind of throw the last question to you here, and then we'll wrap up with our Q&A and kind of sign off here. But what's worked well from you from either a standpoint of leveraging technology, being that you do have to be so flexible as the one person, or communication and collaboration? What's something that's really helped improve your workflow?
Well, I would say, especially for those who are struggling with headcount, use your tools wisely so you don't have to duplicate your work. So in my case, so I was set up on a quarterly incentive. So rather than tracking everything twice, just set up your PRM or whatever system you're using to automatically pull that information for you. And you can even track yourself mid-quarter to see how you're doing versus goals. If you are trying to do it all, then do it smart. So I already alluded to working effectively with marketing to maximize messaging to both providers and direct to consumer, but really just pick your battles and use your tools really smartly so you don't have to do all that work because we all have the same number of hours in the week, and you need to focus and do well with the ones you have.
Excellent. And as we move just into kind of our Q&A portion here, we've got a couple minutes. Should anyone have any questions, you're welcome to submit those through. My question for you, Carrie Ann, is just as we do bid farewell to 2015, what is one resolution, as you reflect on kind of the end of the year, maybe something that you know today that you wish you knew at the beginning of the year that would have really helped kind of your strategy and growth trajectory?
That is a really tough question for me to answer. And I say that because we this year got a new CEO just 90 days ago. We got a new Chief Strategy and Population Health Officer. We have a new president of our health plans. We literally have a brand new senior leadership team within our organization within the last 3 months. And where we were all headed in 2015 was great. It was great trajectory. And we are going to do a lot of changing for 2016. So I think the biggest thing though that I can check off of our list for referral growth is that we've gotten back out there. We've re-engaged these providers in a way that we were not previously doing since our merger as an organization 4 years ago. And so we've proven our value, so to speak, of these outreach individuals, and they're really excited about the direction we're taking as a system strategically for 2016, and that leadership is really excited that we have this team of 20+ individuals who are ready to do the work.
Great. No, I think that's good. I think it's an ever-changing, evolving process. So I think it's important to admit both of our successes, and then I don't like to say failures. I just like to say opportunities for growth, because I think that is the same boat and just an important kind of reoccurring concept. And I talked to Randy Ritz, their Director of Business Development, and over at Atlantic Children's, or not Atlantic Children's Hospital, but Shriners, and he mentioned that what made you successful tomorrow or what made you successful today might not make you successful tomorrow or next year. And so it is looking back at the data and going back to your current strategic plans and saying, okay, well, what's working, what's not, how can we tweak or change this? And that's something that we do here internally with our organization as well. So I definitely understand the boat that a lot of folks are in terms of trying to figure out what the genetic makeup to get to the quickest kind of referral path there is going to be. So if anybody has any questions, like I said, feel free to submit those. Today's conversation was recorded, so we definitely appreciate everybody's insights. Thank you to all of the panelists for being on today. We want to be mindful of everyone's time, as I'm sure everyone's wrapping up kind of projects through the end of the year. So just on behalf of MarketWare, thanks for joining us for kind of our last discussion for the year. We will kick off with our first webinar kind of starting off that second week in January. We'll let everyone know. But happy holidays. Have a great rest of your work week, and hopefully you'll take some great insights from today's conversation into your new year for 2016.